Arif, and I'll be presenting on Cymbalta, also known as Duloxetine. So duloxetine is a selective serotonin and norepinephrine reuptake inhibitor. It is a potent inhibitor of both serotonin and norepinephrine reuptake, however, less of an inhibitor of dopamine reuptake. The medication works by increasing the concentration of above chemicals in the brain. It's available in capsules 20, 30, 40, and 60 milligram. So important considerations before taking these medications. This medication may increase the risk of suicidal behavior and depression. So patients on this medication should be closely monitored, especially when initiating and adjusting dose of this medication. It may cause withdrawals if not tapered gradually. Consider tapering gradually after evaluating risk and benefits during the third trimester of a pregnancy. Use in pregnancy in third trimester is associated with development of complications for the neonates that require prolonged hospitalizations. This medication is distributed into milk and use is not recommended. Allow 2 weeks to pass between stopping of an MOA inhibitor and starting duloxetine. Some of the common side effects of this medication are constipation, diarrhea, somnolence, nausea, may also cause dry mouth and associated with decreased sexual function. So the contraindications of this medication are use of an MOA inhibitor, for example, acetylcholine, in the past 2 weeks, or if you have hypersensitivity to duloxetine or its ingredients, or uncontrolled ankle closure glaucoma. So some of the general administration, the medication may be taken with or without food. Do not crush or chew the delayed release capsules and swallow whole. Do not open the delayed release capsules and sprinkle over food or mix in liquids. Consuming heavy alcohol with when the patient is on duloxetine may lead to a severe liver injury. So some of the drug interactions, the drug is primarily metabolized by CYP2D6 and CYP1A2. Use caution when co-prescribing with other drugs that inhibit or induce CYP2D6 or CYP1A2. It may cause serotonin syndromes, so the caution is advised when using other medications that might also lead to this syndrome. Peak plasma concentration is reached in 6 hours after oral administration. Medication indication. So one of the major medication indications for this medicine is major depressive disorder. This disorder is characterized by 5 or more of the following symptoms listed below, and they would have to be lasting at least 2 or more weeks, with at least one of the symptoms being depression or anhedonia. So the symptoms are depressed mood, sleep disturbances, anhedonia, feeling of guilt, fatigue, diminished concentration, weight changes, psychomotor changes, and suicidal ideation. So a little bit more about major depressive disorder. Women are at higher risk than men. Peak age of onset is in the third decade of life. Some of the screening tools are PHQ-9 and Beck's depression inventory. And then suicidal risk assessment is necessary. So some of the general dosage. Acute treatment for major depressive disorder may be initiated with 40 to 60 milligram daily as a single or a divided dose. May also be started with a 30 milligram daily dose for 1 week and increased to 60 milligram daily. And maintenance treatment is with the 60 milligram once daily tablet or capsule. Optimum duration of therapy is not yet established. Reassess the need for therapy periodically. And when it comes to generalized anxiety, the initiation of therapy usually begins with 60 milligram once daily. May increase dose in increments of 30 milligram to maximum of 120 milligram daily. Drug efficacy more than 10 weeks has not been demonstrated. So some of the special population, let's say if you have hepatic impairment, medication is not recommended to be used in patients with hepatic impairment or an increased or if they, in case they have considerable alcohol use. Renal impairment. Lower starting doses are recommended in patients with mid to mild renal impairment between creatinine clearance of 30 to 80 mLs per minute and increase gradually. Do not initiate if creatinine clearance is less than 30 mLs per minute or end stage renal disease. Here are my references. Thank you so much.